him isn't my husband, but because, wow, what a lot of obstacles for anyone to deal with, especially newlyweds. When I hear people say the first year of marriage is the hardest, I think you have no idea. My endocrinologist recommended I follow up with annual scans for 5 years. Just a precaution, he said, nothing to worry about. I remember at my first annual recall being surprised when I lay down in the scanner to find myself crying. The smell, the temperature, the lighting, just the feel of the room brought back a flood of memories from the year before. After my second set of clean scans, we decided to have our second child. My pregnancy was normal until the end. 2 weeks before delivery, I awoke in a panic, sweating, heart racing, and I was having trouble breathing. Our blood pressure cuff was still in the bedside table from a few years earlier, so I pulled it out and took my blood pressure, 200 over 110. The next day, I made an appointment with my OBGYN and told him what happened. He surprised me by saying that I probably just had a panic attack, which is totally normal near the end of a pregnancy, especially given what had happened last time. I wanted that to be true, so I ignored the symptoms I was having for the next 2 weeks and delivered Megan by C-section as planned on December 6th. I went into shock again during delivery, but with the expertise of the anesthesiologist, I was stabilized and the baby was delivered safely. A few days after being released from the hospital, I called my GP and told her I thought I might have another Pheo. Although she didn't think it was likely, she ordered the blood test and a CT scan. The test came back positive, and the scans revealed that there were Pheos in my lung and lymph nodes adjacent to the original tumor site. The tumors had metastasized. It was time to start seeking second opinions from the experts. My final consultation in a series of second opinions was at NIH. NIH was everything I had imagined it to be, a center of excellence, the gold standard of patient care. It was there that I met the smartest, most humble, kindest doctor I've ever known, Dr. Potzok. He has cared for me and my family since then. That was January 2006. During my initial consult, we looked at three-dimensional images of my body floating in air with little spots of cancer lighting up like fireflies. We discussed treatments and outcomes and prognoses. I learned more in a week at NIH than I ever thought I would care to know about a rare type of cancer. We also discovered that I have an even more rare genetic mutation that predisposed me to this cancer. I have an SDHB mutation. It later followed that so does my daughter and other extended family members. We decided on a course of action, 2 separate surgeries and then chemotherapy. It consumed most of 2006. Following treatment that year, I felt a little lost, though. Was I better? The scans were normal, my labs were normal. I felt optimistic, but the statistics and research about disease progression weren't all that encouraging. In 2007 and 2008, I continued to follow up with scans and blood work every 4 months. Besides missing a day of work here or there to drive up to NIH, it really wasn't a problem, but I always worried on those drives that something would show up on the scans, and for the next few weeks afterwards that the blood work would come back as abnormal. I would describe it as feeling a little bit like a slow and steady climb on the ascent of a roller coaster ride. You think a drop is coming, you just can't see over the top to know when or how steep it might be. During a visit to NIH in late 2008, something new did show up on the scans, but it was small, and I was feeling otherwise healthy, so we decided to continue to monitor the situation. Although the spots continued to grow slowly, nothing changed until the spring of 2009. At that visit, the scan showed some new spots in my lungs and one near my heart. A cardiothoracic surgeon was consulted while I was there. He agreed they should come out, and he could schedule the surgery the following week. How about Tuesday, he said. Imagine for a minute your life, what you have scheduled next week, and then think about how convenient it would be to have surgery on Tuesday. So I called Jason, who called his parents. I called my parents. I called my office. A cascade of events occurred over the next 4 days so that I could be back at NIH on the operating table on Tuesday. The surgery went very well. There were no complications, but when I got home, my body did not recover the way it was supposed to. Instead of being back at work in 2 weeks, like I had with previous surgeries, I was barely able to get out of bed. And in 4 weeks, I was in the emergency room with a pneumothorax and possible pneumonia. 6 weeks later, I was having a chest tube put back in. I couldn't believe it. I was slipping down a slippery slope, and I couldn't get back up no matter how hard I tried. My body wasn't keeping up. A year and a half later, I'm still on pain medicine, serious pain medicine, the kind that makes you drop words in the middle of your sentences and causes your hands and feet to go numb. But it makes the pain tolerable, which is something that my body couldn't do on its own, and for that I'm grateful. In spite of the fact that I kind of decided after this last surgery that that was enough and I really didn't want to do this anymore, my latest scans in the spring of this year had a few new fireflies pop up, 2 more in the middle of my chest and 1 in the back tip of my pelvic bone. The good news is that all of these spots are small. They're so small, in fact, I don't need to go back for reevaluation for 6 months this time. Unfortunately, they're not small enough that I don't worry about them sometimes. However, what I've learned is that I can't control them. No amount of worrying or simply wanting them to go away is going to make a difference. It took me a few years to figure it out, but I think I finally have. I'm not the one in control of this. I never was, of course. I just thought I was. Once you realize that and live with it a while, you do start to accept it. I certainly can't complain. So far, I've beat the odds. One study published in the Journal of Clinical Endocrinology and Metabolism in 2007 concluded that the median survival of diagnosis after first metastasis was 42 months for SDHB mutation carriers. That would set my expiration date at June of 2009, a date that's come and gone. Of course, statistics are just that, they're numbers, and I'm not too focused on the number, but it certainly would be nice to see that number changed or eliminated altogether with new drugs or therapies. I didn't choose to get on this roller coaster and I can't get off, but I feel that part of my responsibility is to minimize the casualties along the way. What has been truly remarkable to me is the number of people that continue to choose to ride with me. My parents don't really have a choice, of course. They're parents, that's what parents do. And my husband and in-laws, they aren't the kind of people that would choose to get off. So they're holding on tight and coming along for the ride. But it would be unfair of me to continue to drag my business partners along for the ride, or my staff who count on me to be in the office and be productive for their livelihoods. So I've decided to sell my dental practice this fall, and as of tomorrow, as fate would have it, I'm officially retired from practice. I'm going to focus more time on my family. There'll be fewer phone calls to make and people's lives to disrupt the next time the roller coaster takes a sharp turn. While I'm sincerely hopeful that a cure is around the corner, I am prepared for the possibility that we won't have the answers we need in time to treat my disease. But I'm almost certain, with your continued support, just knowing how much has already been learned and discovered about this disease in recent years, that by continuing to fund the collaboration of the brilliant minds working on this problem, I can't believe that effective treatments and a cure can't be found for my daughter's generation. And as a mother, that's my greatest hope. The Pheo Alliance is an excellent example of how one passionate advocacy group can really make a difference. I think Margaret Mead said it best when she said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Thank you all so much for being here and putting up with me tripping over my words. I appreciate you being here and for your generous support.